Hi, so today's topic is on autism and genetics. This is a question I get a lot. This is one I have researched a lot, and this is one that research is steadily coming out further and further and further about. So at first it was believed that there was a genetic link with autism. Then people said no, and back and forth and back and forth. Now we are seeing that there is a genetic component to autism. Now, that does not mean that they have mapped out the genome to the point that they can say that this particular gene causes or is linked to autism. There are some links that they have observed, but nothing that they can say, if you have this gene, you have autism. There's not a blood test for it. Now, does autism run in families? It definitely can, and there are prevalence rates there for that. Does it have to? No. Can you have one child with autism and one without? Absolutely. So what we are seeing, or what what we are seeing in research and what I'm reading in research and studying and what research is further proving is that there is a genetic component, okay? It can definitely run in families, if you will. But more often than not, you may see traits of it in families. And when it crosses the threshold there to become a disability, to actually become what we would diagnose as autism spectrum disorder, is when it starts negatively impacting the individual. So if you look at a child with autism and you look at their family tree, you look at siblings, you look at parents, you may see some traits of autism there, but you won't see all of them in one person. So just like autism is diagnosed and it's a plethora, very wide range of characteristics that you might see in different individuals, the same thing within a family. So if a child with autism really struggles with social skills and has a severe language disability early on, okay, we can look at mom and dad. Dad may struggle with social skills, but have very good language and had good language at a young age. So that might be some of the link you see there. But in the child, it's diagnosed, whereas it wasn't diagnosed or probably wouldn't be even as an adult in the dad, because the child is negatively impacted by that combination of factors. So because the child has a social impact and a language impact, and it is negatively impacting his whole world, if you will, his whole ability to function in a preschool setting, pre-K, kindergarten, whatever age. If it's causing a negative impact on how they function with the world around them, including their family, then a lot of times it lends itself more towards being diagnosed as autism. But anyone in the population can have traits of autism.